The role of educators in the learning process is manifold, encompassing the assessment of problems or deficits, providing important information in unique and appropriate ways, identifying progress, giving feedback and follow-up, reinforcing learning, and evaluating learners' abilities. A critical aspect of this role is the assessment of learning needs, which involves identifying gaps in knowledge, attitude, or skills between the desired and actual levels of performance. These gaps are often beyond the conscious awareness of the learners themselves. The assessment process comprises the following steps. First, identify the learner. Second, choose the right setting. Third, collect data about the learner. Fourth, collect data from the learner. Fifth, involve members of the healthcare team. Sixth, prioritize needs. Seventh, assess the demands of the organization. And lastly, take time management issues into account. Close observation and active listening are essential to this process, ensuring a thorough initial assessment that precludes the need for later corrective measures. Learners should be given ample opportunity to express their perceptions of their learning needs, fostering a sense of ownership and active involvement in their educational journey. The assessment of learning needs can take place in a variety of settings, both formal and informal. Data collection is not restricted to pre-scheduled times. Impromptu interactions, whether with patients or staff, provide numerous opportunities for assessment. Needs are prioritized based on their immediacy and importance. Mandatory needs are essential for survival or safety. Desirable needs are related to well-being but not life-dependent, and possible needs are nice to know but not essential. Several methods are employed to assess learning needs effectively. Informal conversations between healthcare team members, patients, and their families can reveal essential needs. Structured interviews, where direct and often predetermined questions are posed, are the most common form of formal needs assessment. These interviews can elicit a learner's views on the causes of their problems, their illness's severity, their health behaviors, and their desired outcomes. In focus groups, small clusters of learners engage in discussions that elucidate various points of view or knowledge about specific topics. Self-administered questionnaires, often in checklist form, offer privacy and ease of administration, allowing for easy data tabulation. Tests, particularly written pretests, can gauge the existing knowledge level of learners and highlight specific needs. Observations of learners' behavior over multiple time periods provide insights into established patterns and specific skill deficiencies. Patient charts also serve as a valuable resource, revealing learning needs through documented progress notes, care plans, and discharge forms. When assessing the learning needs of staff, several additional resources become pertinent. Written job descriptions outline the skills and knowledge required for job performance, offering a baseline for identifying learning needs. Both formal and informal requests from staff for educational programs can reflect perceived needs. Quality assurance reports and incident trend analyses can pinpoint areas where educational interventions are necessary to address safety or procedural errors. Chart audits similarly reveal trends in practice and highlight inconsistencies or new interventions requiring further education. In conclusion, a comprehensive assessment of learning needs is vital for effective educational planning. Through various methods of data collection and analysis, educators can identify and prioritize learning needs, ensuring that their interventions are well-targeted and effective. This process not only enhances the acquisition of new knowledge, skills, and attitudes, but also strengthens the overall educational experience for both learners and educators.